Glad to have you back. If you're just joining us, you're watching the conversation right here on Lagos Television. Tomorrow, July 11, is World Population Day. But today we're trying to beat the race for the conversation about sustainable towards a resilient and equitable future for all. Today is about advocacy on family planning in Nigeria. You know the argument that, look, our population is spiraling, and all over the world you have so many organizations trying to come to Nigeria and say, look, the way you guys are going, right, it's like an explosion of population, and of course your capacity to actually feed yourself and do everything that normal human beings do is beginning to be limited by virtue of this thing. It's affecting your infrastructure, it's affecting your ability to even educate yourself, to feed yourself. That there's a correlation between population and, of course, explosion and ability to have a good living. Well, what do we do about it? You have conversations like family planning, which we'll talk about in detail now, but people also argue that population really matters. Population is money. So how do we balance the two? That's our conversation this morning. We've got an advocate this morning. He's the Executive Director, Public Health Sustainable Advocacy Initiative, Mr. Abiodun Ajayi. It's a pleasure to have you join
Thank you
us.
very much for having me on the conversation.
So this is the first question I asked you when you walk into the studio. Why do we have to talk about population explosion in Nigeria? One of the good things, we call us giant of Africa by virtue of our population. Yeah. And population is also good money. Nigeria has about 60-something% of the youthful population. Exactly. That's ready for market. That's about ready for market. That's huge. Yeah. All over the world, that's a huge market. Energy and, of course, power to do. So why are you talking about family planning in an area where sometimes your number matters? Yeah.
So thank you very much once again. So while we are talking about family planning in this era, if you look at the population index of Lagos, to be precise, we have over 20 million people living in the state.
It's an assumption.
Because
we don't even know our population in Nigeria.
Yes. So thank you for thanks for NLC for choosing a new date to commence that census. But as at what we are working with as an organization, we presume that Lagos is over 20 million people in the state.
And it's still growing?
And it's still growing. So some will come and say it is 20 million people. Some will say 22, some will say 21. So it is good to say that we have over 20 million people in the state. And this population alone, it's a big issue. Yes, it is marketable to say that, yes, a business owner needs population to buy his product or a product. But looking at the structures on ground, do we have structure that will make this population viable in the society? So you need to start asking this question. In Lagos State today, we have over 300 primary healthcare centers in the state. Go to those facility. We are having doctor attritions now. We are having the system and the structures is not even okay to even attend to 100 patients per day. Now, if somebody who is having a headache today, who is having a headache, and gets to the hospital and he or she sees line of numbers of patients, over 100, over 200, he or she might be frustrated to say, okay, let me go back home and then do self-medication. Now, self-medication can, after examining self-medication, that might be a danger to his or her own life. So while we are talking about family planning is to say that, okay, look, why not sit down, analyze and discuss how many children do I need to have based on my own economic strength? How many children do I need to have based on my own capability? So if you are earning 20,000 naira and you have 4 or 5 children that you have 4 or 5 children, how will 20,000 naira take care of those children? So we are putting the lives and the future of those children into jeopardy. So for us as an organization, we are cautioning people, generally Nigerians, to say, okay, why not sit down and then have a number of children that you can cater for? Now, the government, they are not helping at some point in time. If you go to some of our structures in Lagos State, the primary health care center, some are in dilapidated state. 2 weeks ago, we conducted a monitoring and evaluation to some of the centers. And if you go to some places, I don't want to mention some of the local government, okay, you will weep for this country. So it is a big issue. So if the government is not putting all of this in place, why not save the life of those children? Yes, if the Bible, by planning. If you are misinterpreting the Bible says you should multiply and replenish.
Children surround your table.
Does that mean that you should not have those children and then destroy their future? God is not imposing anybody to bring children to this world.
Okay, from those vital issues that you have raised now, I'm going to take it from the angle of Joshua. Look at a country like China. Yeah. Population is an advantage for China.
1 billion.
So can we now look at their structures?
I'm going somewhere.
Okay.
It's an advantage for China compared to what we have here. Yeah. We don't even know our population. So from your submission this morning, are you implying that unchecked population growth is a recipe for poverty, for crime, and disaster?
Exactly. I agree. So now, thank you for bringing the situation, the scenario of China. Go to China again. You will see good governance. You will see leadership across all sectors. So we are talking about sustainable healthcare system, where even regardless of the population, if the structures are there, those structures are good enough to take care of those numbers. Like I said earlier, some of the gaps I need to share with you is the fact that we are having attrition. There's jackpot among the medical personnel. Do you understand? Number two is that the system is not, the structure of the healthcare centers are not even good enough to cater for those numbers. Now, we have shortage of drugs. I'm sure you saw the alarming some weeks ago, a month ago. So it is about putting structures in place. But regardless of that, even China are also very conscious of this. Very, very. Even if they are more than 1 billion or 110 trillion, it doesn't matter. So what they are also thinking is, they will ask themselves questions. Do I have the good economic structure to cater for this?
Okay, so, but shouldn't we tackle this problem this way by knowing the number of people that we have first?
Yes.
If you know your population, then of course that will push you to plan and of course embrace the family planning, which you're trying to preach here.
Yeah. So it's one of our, we had a meeting a few months ago where we also call on government to hasten up with this sense of a thing. We need data. Data is also another problem that we are facing. For instance, Lagos State is doing a lot regarding commodities, which is the FP contraceptives. But the problem is, most of the time, they are always out of stock. Why? Because even the government, does not even have the total number of people living in the statistics. The correct number, data.
Lastra does. If you register with Lastra.
So how many people are on Lastra? How many people have registered on Lastra? So these are also critical questions we need to ask. So it is when we know when we have a data on the table that we can start planning with that data, which I agree with you. But for Nigeria, for Lagos, I would say that data is not comprehensive enough.
Okay, you talked about government. So let me just take you back a little bit. You know, in this country, we are culture-driven. We are religious people. And oftentimes, it is a function of the perception of people, how they were brought up, the culture. You can still marry as much as you can. You can still have babies as much as you can. And the most important part, which I think you've not touched on, is education. So you have so many people who are not educated, who can't relate why you should have limited babies that you can take care of. Vis-a-vis when your religion says you should do this as much as you do, or even have babies. It's like making babies is like a leisure, considering that the guy is broke, he doesn't have anywhere to go. The best kind of leisure, the best type of is to make babies. It's best, honestly, and we find so many people. Of course, there's a correlation between poverty and more babies and education, less babies, because that's what it gives you. So I noticed you focused on government not doing enough in terms of providing infrastructure.
Funding.
But how do we handle the issue of, don't tell me, like, the religious background? We've quoted some scriptures this morning, and I'm sure for the Islamic friends, they will have something in that regards to that God will take. And there's a saying that nkoto mo ma je.
Yes.
Wonderful.
Yes, Big says that. So the bottom line is, so how do we handle all this? These are embedded cultural beliefs that we can't just, by speaking plenty English on TV, say forget about what you were brought up with.
So thank you. So for us as an organization, thank God the Challenge Initiative powered this conversation today. And as partner, we have a number of partners with the Challenge Initiative, which Interfaith Public Advocacy Initiative is also a member of the group, the technical group. So what they do basically, we collaborate with them. We go to mosques, we go to churches, we even engage the traditional rulers or leaders rather to also educate them about family planning. So we don't just address the issue of government too. We also engage in sensitizing the public. We do we carry out number of webinars just to educate people. We go to community.
What's the impact of that?
So the impact is to change their mindset, because a lot of them have this cultural norm, the cultural belief that just like we're quoting now, if you do this, that is against the Bible. The Bible does not restrict giving birth and the like. So we also educate them that. So if you are misinterpreting Bible, so is it the same interpretation that will help you feed your children? And some people also have this perception that my health, if I do family planning, I will have this implication. I will do this. So these are things, these are knowledge that we share with them to say that it has nothing to do with those things. Family planning is for you to, if they give you 2 years, and then they ask you not to do this, follow the instruction by the doctor or the nurse who is giving you such family planning method.
But we've seen family planning have implications on people. You have
very bad ones.
It is a wrong perception. Yes, so majorly too, we need to also understand that some people
it's
have...
It's not the percentage, it happened to me.
I've seen some women, because of the family planning contraceptive that they're using, they are getting bloated.
So that is where I'm going. You know, some people even have this natural, how do I put it? They have the natural structure to grow big. You understand? So when they take family planning, some of them will say, family planning, it is a wrong perception. So what I'm saying is this is one of the
aside from getting
misconception rather.
There is another one. I don't know what language to use to describe it now. If they put it somewhere and by mistake it's shift. You're in trouble. You can start bleeding.
Yes, so we have had implications. We have had some of these implications too. But one of the things, like I said, it is about information and knowledge. If a doctor asks you to do this,
how are you ensuring that our women, especially those ones at the grassroots, are knowledgeable enough when it comes to family planning?
So that is why you don't see us mostly on televisions alone. We go to communities where it is even hard to reach to some people. So we don't limit our sensitization, our campaign to TV, to radio, to newspaper, to anything. What we do is we go to grassroots level. We even make use of local news to also project all of this information.
When you have people like me, and of course you are under pressure to have more children, because you only have boys, like 4 boys, like me that have 4 boys, they said, look, you need to balance the equation. You need to have a girl. You
end up having 6 boys.
He's laughing at me. Because my neighbor has 4 girls, and I know they went to 7 because they are looking for a boy. The boy didn't come anyway. So how do we handle...
7. So the thing is this, my brother, sir, you need to sit down.
I didn't know. I was with them when they were doing it. I'm not saying that. From what I can calculate,
7.
When I noticed the 1, 2, 3, they got to like 7.
You know, I don't want us to trivialize what Joshua raised. No. Because there was a particular guy.
These are educated people.
There is a particular guy that I saw here. I don't want to mention. You know, he's barely educated, 7 children.
Yes.
I was told, and the guy can barely feed himself.
That's the child. That's where I'm going. So, for you, in your own case now, if you want to have 10, if you want to have 100,
my case, point.
Okay. Because of the example you cited just now. Now you need to do self-evaluation. What resources do I have to take care of them? Am I working? Do I have sustainable economic growth to say, okay, even if I have 10, I can take care of them? Abiola has many children. When he was alive, all of them were doing well. And we have had cases of rich men who have more children. Why? Because they understand that they have resources. But look at I cited it earlier. Somebody who is earning 50,000 naira and is giving birth to 6. Let me give you two visible evidences too. In Ogun State, I know of a family who has 6 children, and they are young. The family the husband is about, I think, 39, 40, and they already have 6 children. Now, because he does not have good economic growth for himself, do you know that the last born he gave birth to, who is just 2 years, you will never know that guy is 2 years. You think he's 6 months. He's having medical complications.
He's malnourished.
Yes, the boy can't walk as I speak to you. He can't walk. So these are issues that we are talking about. Another one in Ejigbo, where I reside, he has 5 or 6 children. While he was trying to take care, 3 of them were having medical issues. Maybe one is having headache and one was having fever. And so, because he couldn't have resources to take care of the 3 children at the same time, he went to call quack nurse to give injection to the girl. Oh, very beautiful young girl. I think she's 5. Very beautiful. As I speak to you, one of the leg of that girl is condemned. So these are implications we are telling families to look out for. It is not about having children. It is about what resources do I have. This government structure is not there to take care of all of this. Okay. Now, you don't have money to take that boy or that girl to a private health care center or a government hospital or a private hospital. And we have been shouting, go and enroll your family in Ilera Eko. Some of them didn't believe, some of them don't even believe government.
Abiodun, there is this gender inequality when it comes to family planning. We always look at women, forgetting men. Because of men, they are habitual baby makers that they don't think of any other thing aside from making babies. And they put these women under pressure. So when it comes to family planning, is it all about women or a joint effort between a man and a woman?
It's a joint effort. But one, we need to establish that who is the most vulnerable? They are the women. So that is why we need to strengthen women's health in Lagos. Government must prioritize women's health and rights.
Is there any contraceptive for a man?
Yes, condom. We have male condom.
I know.
I'm married. And I also make use of the male condom. Yes. I'm glad to say that. So we are also engaging men. So we have had disapproval from men more often. So what we try to do is to educate men on how to ensure that they also accept family planning method for their wives.
I have 2 questions for you, woven into one. I'd like to know the current state of access to safe and effective family planning in Lagos, if it's Lagos or to women in general, especially in Lagos and local government where you've been conducting research. And if access is limited, what are the main barriers and challenges preventing women from accessing family planning?
So number one, I would say that for Lagos, looking at Lagos as perspective too, Lagos is doing well when it comes to family planning counseling. Yes, I can tell you again, 99% they're doing well. But when it comes to access to commodities, is a big gap.
What do you mean by
commodity? They are the contraceptives, the injectable, the implant, those methods, those tools that women use. So it's a big challenge for women. So which we feel that the government can also help increase those. So Lagos State is doing, there is what we call funding for commodities, which Lagos State purchase those things, either from private company or from private to be precise, and they sell at different local government PACs and the like. They give out. They give out free. So, but we want to appeal to government to increase budget line for this so that we can always get the. But like you said earlier, when we have data, it will not be difficult for us to get those things. So, what are the barriers? The barriers are the things we said earlier. Cultural barrier is there. And then even the structures are also discourage women to also go to a private PAC. You can't imagine you go to a PAC and the structure is looking dilapidated. Nobody will want to assess it. Or you go to a PAC and only one doctor is attending to 20 people or 100 people. So it is a big challenge too. Men disapproval of their wife of getting family plans is also a challenge we face. And at the local government level too, I need to call on all the chairmen of the local government in Lagos State to engage in funding family planning in their own locality too. We got to some local governments in Lagos and we are not happy with the result. I can't start mentioning some of these local governments here.
What did you observe?
The structures. Number one, the structure. Go to a PAC center. The chairman has not. Some of the chairmen have not been funding the healthcare center. And when they get to some state level meeting, they start apportioning blames on the PAC. But PAC have asked you to take ownership too at some point in time. We alone cannot run it because it is residual. It is resident in your own local government. So you need to take responsibility.
Okay. So how critical is the role of family planning in reducing poverty in the society and creating economic opportunities?
So in our previous conversations, we have also looked at this. When you have 2 children, it helps you save your financial outcome. You understand? And you will start thinking about how do I want to improve more. I know some family who have 2 children all their life and check their life. They are okay. Either 2 male, either 2.
It's 2 not too small.
You
have like 4.
Okay.
Your father did not have the 2.
Yes, my father has 5.
Yes. Why can't you do that? Are you not supposed to be greater than your father?
I don't want to. No. Not in that regard, my brother. Not in that regard.
You're supposed to do more than your parents.
No, let me do what I can handle. It is not my friend that will come and help me finance my family.
No,
what my father went through, I should not go through it. Don't mind it. So the matter is this. It also creates an enabling environment for you. You start thinking about, okay, this is the resources I have. How can I transform this? How can I transform these resources into economic growth that will also better the family that I am building? So it helps reduce poverty. And then looking at it from the holistic view too, the number we are talking about is not saying that the number is not good. The number is good. We all take advantage of all of this number. Everybody who come on social media always want millions of people following us and they like, so they are good. But we also need to narrow it down to how sustainable are this number to our life, to our economic growth.
Okay, I'm a little bit bothered because from all the indices in the southern part of the country, it's still relatively good. Because by level of their education, they've been able to curtail. Hardly you will find in Lagos now anyone who wants to have babies more than 2 or 3. Average what you find in Lagos, but we still have
that 7 is in Lagos.
We have 10 too. Go to Ajayi.
It's by virtue of their education. I'm sure. Maybe, and I told you it's a recreation. Recreational sport is having sex with your wife. So and the more since you didn't do family planning, you do it. But in other parts of the country, because the resources is shared from the federal level across all the states of the federation. So you have migration still coming in. You're stretching the infrastructure. So it's not about Lagos alone. If one part of the head is not feeling fine. So you have in the north, we have explosion in the north. Well, that's why you have the Almajiri and the Benin. That's why we find them here migrating to the south. So how do we handle not only, because Lagos is bearing the brunt of population explosion in some parts that is not curtailed by family, because most of them don't believe in that. So how do we get the binding of not only Lagosians, which here we're speaking, but every other part of the country to understand what it means to have explosion without commensurate growth economically?
So for our intervention is not restricted to Lagos alone. So I think I was supposed to establish that. We have had so many number of campaigns in the north, and then communication differs too. The way I would discuss family planning with you in the south here will be different from the way I'll communicate that in the north. And if you look at the intervention of some of the governors in the north, they're also taking family planning into consideration. They might not come to the public to say don't have number of children like this, but they're also creating measures they are establishing measures to curtail all of this issue. Look at what the governor of Kano did some weeks ago, where he allocated billions of naira for the renovation of education schools in Kano State. So it is a way of bringing those almajiri back to school. So when we are educated, we will know that, okay, because I am educated, I'm not supposed to have this number of children. So education is also a key. And then look at also what they're also doing, prioritizing health sectors too in Gombe. I think Gombe team came to Lagos to also examine, to do learning exchange in Lagos State to know, they visited Ministry of Health in their delegation, the commissioner, the SA on health to the governor. They came to Lagos to learn how it is being done, how Lagos did theirs to curtail that. Because the cholera issue too, see where it started from. It started from them. In Lagos here, and it spread. So Lagos is a very sensitive state, but we are not relenting. So we are expanding. We have expanded, let me put it that way, because we are not just doing it, we have expanded. So in all those states, we are also letting them know that this is very, very big issue. It's a very big issue to the future of this state, and you must take full responsibility.
What bothers you the most? Perhaps this is my own final question before Jibola pops in. What bothers you the most every time you think about, look, the way we're going, right? We keep talking about want to make it, but our population is not helping matters. We're just sharing the little we have with so many people. Just yesterday, the federal government, on Monday, the federal government gave permission for us to import all the things we banned before, because we have food inflation in the country. So how do we, what bothers, every time we think about population and our economy, what bothers you the most that makes you want to talk about this?
So what bothers me more is looking at the challenges some of this family battle. You know, just like the story I shared now, it's
self-inflicted.
Yes, it's a touching stories for me that feel that we need to go all out to save other families that are experiencing this, or perhaps family that intend to have more children. So this knowledge sharing could be a way of restricting them and helping them, you know, while defining their future. So, and if you look at it too, we are all going to suffer for it if care is not taken. Now, that family that we don't want to educate, their children might be might one day come to your house and then rob or do something nasty or do something, you know. And rape issue is also very rampant. Drug abuse is very rampant. And look at all these children on Oshodi Bridge. If you pass through Oshodi Bridge, there was a time at about 10 p.m. in the night, I mistakenly dropped on that bridge. It was a mistake. And while I dropped, 10 tout, they came to me because I was with 50,000 in my pocket. And I don't want them to rob me. Do you know that I shared 500 now to each of them before they could allow me go?
Lagos sense.
So it is, so if somebody somewhere has educated the family of those children.
Were you in CAP? Like
I was in CAP
no,
I was coming from GRA here for an event here. So it really bothers me. So if some of us have not experienced it, a lot of people are experiencing this issue. So if you are saying I don't want to talk about it, one day you'll be driving somewhere and they will boggle you.
Not planning your family is also responsible for the number of miscreants that we have in the society.
Yes, yes. So planning, that's why it is called family planning. It is not, family planning go beyond number of children you want to born. It also has to do with sit your wife down. How many do? So which school should we enroll our children? What opportunity should we give her? So
why
it
not
is
sit your man down?
Sit your man down to not
always
be
women.
man alone sitting their wife down.
Okay, I want to say thank you very much. I'm not true because I have so many questions.
After the show,
thank you.
You can ask any questions.
Thank you very much, Abiodun Ajayi, for joining us today.
Thank you so very much.
Your information you've shared. Hopefully, we can have you back again. We need to talk about this. Okay, that's about it. Conversation Lagos is sitting by pretty for the next set of guests. Don't go anywhere. It's still the conversation.
Thank you.
The views expressed on this program do not represent that of the producer, management of Lagos Television, or the Lagos State Government. They remain the perspectives of those expressing them. Thank you for staying with Lagos Television.